In this lesson, we will look at physiology of physical activity. Our objectives for this chapter are to cover the key features of the subdiscipline of physiology of physical activity and employment opportunities available to exercise science professionals, explain how physiology of physical activity fits within kinesiology, and review the history and development of physiology of physical activity as the subdiscipline. We will also identify the research methods used by kinesiologists working in exercise physiology and examine how the body responds to physical activity and how these changes relate to physical performance and health. Looking at the goals of exercise physiology, we're seeking to understand how to enhance physical performance, how to improve physical function in altered environments, such as those characterized by high temperature or high altitude, to understand how physical activity and exercise improve health fitness, to understand how exercise can be used in treating and preventing disease and alleviating symptoms of disease, and to understand the adaptations in physiology and pathophysiology in response to physical activity. So what is physiology of physical activity? It's the study of acute or immediate physiological responses to physical activity and the changes in physiological responses to chronic, which is repeated over time, physical activity. These illustrate your body's way of meeting the increased demand of oxygen, energy, and temperature regulation associated with physical activity. Exercise physiologists apply principles of biology and chemistry to understand how the body responds to physical activity. This serves as the foundation for conditioning, fitness, and rehabilitation programs. Often referred to as exercise physiology, this is a subdiscipline of the biophysical sphere. Looking at why we use physiology of physical activity, the main reasons are to enhance sport performance and training, improve physical fitness, promote health and treating disease with physical activity, and understand physiological changes from physical activity. Looking at the health effects of moderate physical activity, it has been found to be beneficial in reducing the risk of chronic diseases such as heart disease, diabetes, hypertension, and colon cancer. There are significant research findings linking physical activity and health. So what do exercise physiologists do? They work as university professors, researchers for the military or NASA, corporate fitness or hospital-based wellness programs. Clinical exercise physiologists are employed by hospitals in cardiac rehabilitation programs, working as exercise instructors or personal trainers, strength and conditioning professionals, and then specializations with older adults, children, or pulmonary patients. Looking at the history of physiology of physical activity, the earliest beginnings evolved from physiology. Two of the early contributors to our understanding of physiology of physical activity were August Krauss of the University of Copenhagen and A.V. Hill of University College London. Krauss developed one of the first cycle ergometers. An example of an ergometer would be an exercise cycle, which is used to study physiological responses in exercise. He received the Nobel Prize in Physiology in 1920 for his research on the regulation of microcirculation. In 1921, Hill received the Nobel Prize for his work on energy metabolism. In a classic paper, Hill and Lupton presented many of the basic concepts of exercise physiology related to oxygen consumption, lactate production, and oxygen debt. In the 1920s to 1940s, we had a lot of opening of the early laboratories in exercise physiology. Our early understanding of exercise physiology was shaped by research conducted at the Karpovich and Curitin laboratories established in physical education departments in 1927. Dr. Peter V. Karpovich established an exercise physiology laboratory at Springfield College in Massachusetts. Karpovich became well known for his research on the effects of ergogenic aids on physical performance and served as one of the founders of the American College of Sports Medicine, or the ACSM. The secondary laboratory, established in 1944 by Thomas K. Cureton, Jr., was located at the University of Illinois. This lab became well known for research on physical activity, and many leading investigators of physiology of exercise were trained there. The Harvard Fatigue Laboratory conducted many studies in the early years of research on sport performance. The laboratory included a room containing a treadmill borrowed from the Carnegie Nutrition Laboratory, as well as a large gasometer, a room for basal metabolism studies, an animal room, and a climactic room. Research undertaken by members of the laboratory included environmental studies conducted on high altitude, in the desert, and in steel mills. In the 1950s, Morris coronary heart disease study of England stimulated research in epidemiology of physical activity, fitness, and chronic disease. Morris published a study on coronary heart disease and physical activity in which they found that drivers of double-decker buses in London were significantly higher disease risk than did the conductors of those buses. The study stimulated interest in epidemiological research on physical activity, physical fitness, and chronic disease that continues to this day. The Morris research also stimulated studies of the effects of fitness and endurance training on risk factors such as serum, cholesterol, and blood pressure for coronary heart disease. In the 1990s, the NIH, National Institute of Health, and Surgeon General's reports provided information on physical activity is a major risk factor for cardiovascular disease, and moderate levels of regular physical activity confer significant health benefits. Looking at research methods and tools in physiology of physical activity, we can begin with ergometers. Ergometers are anything that measure exercise output, so it could be a treadmill, a leg or arm cycle, or a swimming flume, anything along those lines. We look at oxygen uptake. We have electronic analyzers and gas volumes. Body composition we can measure through underwater weighing called hydrostatic weighing. We can use skin fold calipers that you'll learn to use in class, or DEXA is what we call the gold standard in finding body composition through X-rays. Biochemical methods we use looking at blood samples and muscle biopsies. Animal models are mammals that match humans as closely as possible, and we can control the subject and environment more easily and specifically. And now there's more field work outside of the lab than in the early days of study. Technological advances have made field work more practical. Our equipment is now smaller and easier to carry around. Some major areas of study in exercise physiology include how physiological systems like cardiovascular, muscular, and respiratory respond and adapt to physical activity, whether it be single or repeated bouts, factors that influence physiological responses such as temperature, diet, and altitude, and relationship among fitness, activity, and health. Another area that's commonly looked at within exercise physiology is skeletal muscles. We have two different types of, well, we have multiple types of muscle fibers, the major types being fast twitch and slow twitch. And we have muscular strength versus muscular endurance. So muscular strength is your max one repeated measure, and then your muscular endurance is how many times you can lift something over and over. And then we have adaptations of your muscle to anaerobic and aerobic training. Your anaerobic training is your quick, very quick bout of training, and aerobic training is a longer bout. And to resistance training. And then we have different training principles. We have a progressive overload principle and the specificity principle. Looking at some study from the cardiovascular system, we have cardiac output is the amount of blood pumped out of the heart each minute. It's a function of both heart rate, your number of beats per minute, and stroke volume, the amount of blood pumped per beat. And we look at blood flow distribution. Cardiovascular adaptations to training, and aerobic endurance. During physical activity, cardiac output increases as the muscles use more oxygen. Oxygen uptake increases in direct response to the intensity of the exercise until maximal oxygen uptake, or VO2 max, is reached. Looking at the respiratory system, it regulates the exchange of gases, including oxygen, between the external environment, the air, and the internal environment inside the body. Ventilation increases rapidly at the onset of physical activity and is also a function of exercise intensity. Training can alter the efficiency of the body to move and utilize oxygen. Looking at variation in temperature in response to physical activity, we tolerate physical activity in cool environments better because our bodies lose heat from blood close to the skin, as well as from evaporation of sweat. In cold water, however, heat loss from the skin increases dramatically because water is an excellent conductor of heat. Submersion in cold water stimulates shivering and an increase in metabolic rate. With the effects of exercise, muscle contraction produces heat, which helps maintain the body's internal temperature. During physical activity, increased heat production by skeletal muscles stimulates vasodilation of skin, blood vessels, and sweating. Looking at acclimatization, when air temperatures approach or exceed skin temperatures, the body mechanism for bringing warm blood to the surface to cool is not as effective in this case, evaporation of the sweat becomes a major avenue of heat loss. In hot, humid environments, like Houston, heat loss through evaporation is also limited, which results in higher body temperatures and an increased risk of heat illnesses such as heat stroke or heat exhaustion. The effect of increased internal heat related to increased physical activity and its impact on vasodilation of the skin, blood vessels, and sweating is significant. At rest, only 15% of blood goes to muscles. During heavy activity, 2/3 of the blood goes to the muscles. Areas that need blood flow vasodilate, and areas that need less vasoconstrict, making them smaller. Levels of nutrition also affect energy and performance. Carbohydrate intake provides for optimal performance and health. Proteins work for repairing and replacing damaged body tissues, aiding adaptations, and maintaining functional metabolic pathways. Fluid and iron are also important factors. Interdisciplinary research that blends exercise physiology and dietetics work to improve personal health and support high-level sport performance. Looking at connections between physical activity, fitness, and health, age has a large effect on fitness. Your VO2 max declines with age, lesser so in individuals who remain active. Physical activity, fitness, and coronary heart disease are also connected, as much as 46% lower risk of dying from cardiovascular disease if you are highly active. Looking at physical activity and weight control, in addition to burning calories through activity, metabolic rate is also increased proportional to the intensity of the activity. The recommended amount of physical activity for improved health and decreased disease is 150 minutes of moderate intensity activity or a week, or 75 minutes of vigorous intensity activity. Body mass index, or BMI, is a commonly used measurement in exercise physiology. BMI is found by dividing the body mass in kilograms by the square of height in meters. BMI assessment is easy and non-invasive. Elevated values are indicative of obesity-related diseases. However, it is not a measurement of body composition, so athletes with high levels of muscle can be mistaken for overweight. A BMI of greater than 30 is classified as obese. In the year 2011 through 2012, 35% of adults, 21% of adolescents, and 17% of children were found to be obese. So we have now completed our sphere of scholarship of physical activity, and moving forward we'll be looking at professional experience in physical activity, looking at health and fitness, therapeutic exercise, teaching physical education, coaching and sport education, and sport management.